Welcome to the UNM Healthcast. My name is Elizabeth Dwyer-Sandlin, and today we are here to talk about the UNM Health Sciences Hackathon. And we are here with a group of folks who won the hackathon in 2020 and have since been working on the company that launched as a result of that win. And it's going to be a really fun conversation. So lucky you for all being here to witness this today. We have several guests with us, so I'm going to introduce everyone and make sure everyone gets a chance to chime into this awesome conversation. So first of all, I have Christian Slough, who is the co-founder of Thuvia Systems LLC, and Amelia Byerly, who is the Chief Hat Officer of Thuvia Systems LLC, and Paul Sauter, PhD and CEO of Thuvia Systems LLC, and Dr. Pavan Mutil, who is Associate Professor of the College of Pharmacy. Welcome, everyone. So I just really want to dive in by talking about the hackathon first and what in the world is that, because most of the people watching this are not going to know what a hackathon is or what the, how it works or what the point of it is. So if one of you could volunteer to just give us a little bit of that background, that'd be great.
So a hackathon is a kind of a startup weekend, and a startup weekend is kind of a standard format across the country. So what happens is people who have a problem in mind, a problem they'd like to solve, they do a 1-minute pitch on Friday afternoon, and teams form around that person. So in a typical startup weekend, most of the projects won't assemble a team, and teams will form around the projects that people think are the most promising. Then people will work on the project for a couple of days, doing customer discovery or prototyping or planning a presentation, everything. And then late Sunday afternoon, someone gets up and gives like a 5-minute talk and does Q&A in front of a judge. So the CTSC Health Science Hackathon is different from most startup weekends that I've been part of, in the sense that the CTSC Health Science Hackathon is a lot more generous with supplies. There were a lot of prototyping supplies. So the Raspberry Pi and Arduino boards, soldering station, 3D printers, that was extremely helpful. So it's a very highly facilitated startup weekend that's focused on applications for biomedicine.
That was an amazing summary. Thank you. So who among you would like to tell us how your team came together at the 2020 hackathon?
So Christian and I attended a healthcare conference in Washington, D.C. And one of the big takeaways from that conference was the power of data and how data can impact healthcare. And so we came back to Albuquerque with that in mind. At the time, I was working in Pavan's lab, and we work with inhalers and inhaled drugs. And so I started to think about how data could be applied to inhalers. And that's when I came up with the idea of using data to inform patients about how their medicine and about their triggers, and how you can use all of that information to have more informed decision-making when it comes to medicine. And so Christian and I thought it would be a good idea. I think Pavan was the one who mentioned hackathon first, but we came up with a pitch. So on our first day, we pitched the idea. I think Paul was one of the first people to come up to us, and that was really the start of the formation of our team that you see here today.
So when you talk about inhaling the inhalers and things, you mean for folks who have asthma and stuff like that? Can you put it in some layman's terms?
Yeah, for Pavan, the inhaled drugs go beyond just asthma, but for this project, we did focus in on asthma. And the reason for that is because asthma is a chronic disease, and so it requires that people take medicine every single day, which imposes a big toll on them and on their daily life. And so that was the idea about bringing a smart inhaler, capturing data with an inhaler.
Okay, well, that obviously begs the question, what is a smart inhaler?
It can capture data, or a lot of times connect to a cell phone. And so in our case, that's exactly what we're talking about, is an inhaler that is capable of communicating with a cell phone, specifically a smart cell phone, so one that can connect to the internet and capture data on its own.
Cool. So when this idea came forth and you all started working together, what does it look like to be in the midst of the CTSC hackathon and launch into your work? What does that weekend look like? What did it look like for the four of you?
for a lot of the students, I think it's fair to say that it's really intimidating when you first walk in there. I came from the business background and a lot of people were from engineering and science. But that's one of the cool parts about it also, is getting a lot of different perspectives. And sometimes at UNM, there's maybe a divide where Lomas is between health sciences and the rest of the school. But I think when you look at our team, we have people from all different backgrounds, different experiences. And so we ended up winning, I think, because of that and some of the experiences that they brought. But then you get out all the toys that Paul was saying, the 3D printing, the Raspberry Pis, and it really kind of takes you back of how New Mexico is supporting one another. There's people from Sandia, people that were retired, professors. It really feels like you're jumping into the deep end, but by day 3, you feel like you're not an expert, but you feel like you're an expert after you've really dove into everything and worked on it for basically 48 hours plus straight, day in and day out, so that you have everything done by the last day.
Okay, I'm a writer, so I have no idea what a Raspberry Pi is beyond the delicious thing that I eat for dessert sometimes. So what is a Raspberry Pi?
Paul could probably better describe it, but so from the non-engineering perspective that I have, it's a very simple chip that people can program, lights to turn on and off, lights to switch colors, very rudimentary engineering. And I can use those words, but I have no idea how to use them. That's why we needed some of the people from the engineering department on our team.
So basically it's sort of minimal unit for running microprocessor controlled things. So there's a way to program kind of a standard and inexpensive board to respond to various inputs by doing different outputs. And that's the Capsule Summary. So it's instead of putting everything together from scratch, it's a module that you can just drop into any existing project and have much of it already built.
Cool. And so Dr. Mutil, I noticed that Amelia said earlier that inhalers go beyond asthma for you, but this project focused in on asthma. Can you tell us a little bit about your background?
Absolutely. So Amelia had been working in my lab for more than a year when she approached with this idea. So my background is inhaled drug and vaccines. Asthma has been there, inhaled medicines for asthma has been there for now more than 50 years. So that's something that's been established. But when you think of inhaled vaccines, some of the things that people are working around the world is that for COVID-19, it's an inhaled disease, it affects the lungs. Can we have an inhaled vaccine, right? So there is a lot of research going in there. But beyond that, for the last 20 years, I've been focusing on inhaled vaccines for diseases like tuberculosis, because TB also is the disease of the lung, right? So can you have a vaccine that can be given to the lung or drugs given to the lung? So that's basically my background that I've been working on. So when Amelia came to me, I said, yes, I have some experience working with inhaled drugs and vaccine, but not so much with asthma or with asthma inhaler. So there was an element of knowledge for me, but there was a lot of things that I could have gained joining this. And just to add to what CJ said about hackathon event, I think we went in there, we had a fantastic team, which in the last 2 years, I take a lot of pride because it's from different fields. Like you said, Raspberry, CJ tried to explain and Paul tried to explain. I still don't understand what that means. I'm a pharmacist by profession, and that's where we have members who are engineers who know the ins and out of that, right? So be it Amelia, CJ, Paul, or other members of the team, they all bring their own expertise to the team. And I think that's the good thing of hackathon, is that it tries to bring different, diverse fields together to solve one big problem. So if I would have been in my silo just doing pharmacy or doing inhaled drug delivery, I don't think so we would have achieved what we have achieved in the last 2 years as part of the CTSC Hackathon and beyond.
Okay, I do want to talk about the company that evolved from this, obviously. But before we get to that, I want to stick with Hackathon a little bit more. So for the CTSC program, I know Amelia said that you just mentioned as well, Dr. Mutil, that she was working in your lab. Is this an event where students are the ones who come forth? Do you have to be a student? Could I get a weird, wily idea about some scientific project that I was like, I don't know how to do this. I'm going to go to the hackathon and try to find people to help me do it. Or is it for students exclusively?
The main constraint from the standpoint of participants who came in without a project like I did is that you can't win one of the awards without a UNM faculty member on your team. So if you have a great idea and you come in off the street and treat it like a startup weekend, you might have a good experience, but you're not eligible for the prize. And I think people have to know that. But other than that, for UNM faculty ideas, someone just has to agree to be part of the team, but a student, a grad student, a postdoc, anyone could present, or the PI could present. So, anybody representing that lab can present.
So just to add to your question, Elizabeth, anybody from, even if that person is not a student, can come and present, right? Anybody from New Mexico can come. The big caveat that Paul mentioned was that you need a PI from the health science campus. That could be the School of Medicine, Nursing, or Pharmacy, where we have that aligns with that idea over there, because this is the CTSC Hackathon is an event where we are looking for some sort of a solution for a biological problem, right? So, but anybody can come in there. We form teams in there. You just have to have a great idea and brainstorm that idea in the 2 days that you have and form a team. And you can also come with the team beforehand if you have an idea. So I think everything is feasible, and you can have more members join your team as the day goes by, that weekend goes by.
And so what exactly are you trying to put together in the weekend itself? Because obviously a lot has sprung up since then for all of you, but in that 48-hour period or 72-hour period or whatever it is, what exactly are you required to put together and present at the on the last day?
So I was going to talk on this a little bit when you asked earlier, so I'm glad that you had this question, because 48 hours goes by really, really quickly, especially when you start to think you have to sleep and eat in there somewhere. And so I think we were really fortunate to have Paul on our team, because he'd been to these events before. And so on day one, we kind of outlined the whole weekend in terms of what are our deliverables going to be, and how much time is it going to take to make those deliverables come true. And so you do have to be very practical in the sense of what can you actually get done with the time that you have. And then at the end of the day, you have to remember that it's a pitch. And so you come with an idea, but that idea does not need to be realized by the end. And so you need to deliver something that people can look at, can feel, and be realized enough that it makes it feel like a real product. And so for us, what we did was two main things I think were really valuable to our success. One, we went and got customer feedback. And so we went to the surrounding areas, we went to the hospital, and we asked people what they thought about our idea. And so we got actual customer feedback on our idea, which was really awesome. And then the other thing that we did, and we don't have our engineers here to talk about it, but we were able to make a very crude prototype. And so that goes back to that idea of the Raspberry Pi. But essentially, we were able to program the Raspberry Pi to light up on certain cues. And so it was, a very basic program that they put together. I mean, that's what they said. I wouldn't have been able to do that. But very basic. And what it did at the end of the day was bring our idea to life, and it was enough to convince the judges and the people in the room that our idea had real potential.
Paul, you wanted to add something?
Yeah, so I'd say, your main task, the most difficult task for some teams, is on the pitch on Sunday afternoon. You have to get inside the minds of the judges, and if you have never done this before, that's really difficult to do. So I've been on like both sides of this, and so what the judges really want to see is that you're posing a problem that appears to be serious, where there's a lot of pain and people are going to demand a solution. They also want to see projects where 10K would make a difference. So I think some of the projects that didn't make it last time, it looked like if you put $250,000 into there, they'd blow it through it in 6 months and they still wouldn't have a prototype. So the projects that tend to win, both in startup weekends and in the CTSC Health Science Hackathon, the prize money and the advice from the judges looks like it would really move the needle on that project. So some projects are too small or too inconsequential. Other projects are too large. So you're looking for that Goldilocks project where 10K and a good team and a good pitch is going to actually make a difference.
Dr. Mutil, you wanted to add?
Yeah, just to add on to what Paul said, I think two things that I'll add in here is that the presentation that you have to make, which Paul helped us, is that many of us who are in research, whether they are students or even faculty, we are very research focused, and we try to put in a lot of research slides, but it's not about research, it's about how you can convince the judges. So there has to be a pitch deck, I would say, and of course, Paul knows this very well. The second thing I would like to add is that if somebody is really interested in attending this year, is to just watch Shark Tanks. I mean, this is how that's the way it is, but they can just watch Shark Tank and see that how pitches are made if they are not aware of this. You just have to come up with one great idea.
That's a solid recommendation. It's interesting how much the entertainment business in the world of science can overlap. This is just all reminding me of like going into a room to pitch a TV show to executives and stuff. And what Paul said about getting in their minds. It's a lot of overlap. Plus 48-hour film festivals. 48 hours goes by so fast. I've made a movie from writing the script to editing and having it done in 48 hours, and it's hard. So it seems like there's a lot of Paul has another recommendation, or read Art of the Start by Guy Kawasaki. Is that a book about these weekends, or is it about startups? What's that about?
Guy Kawasaki was the pitch coach for Steve Jobs. So when Steve Jobs gave his monumental keynote addresses, which were brilliant, everyone just thought it was him, but he had a team working with him, honing his pitch, rehearsing it, and Guy Kawasaki was part of that team. So in that book, Guy Kawasaki has the 10-slide deck for a 20-minute or 15 to 20-minute pitch for investors. And that, I think the most important thing about that deck is not that it be followed religiously, but most people who are scientifically oriented are surprised, because in the 10 slides, one of them is about the science and 9 slides are about everything else for the judges. And that's why I would recommend it for the CTSC Health Science Hackathon, because people will get up and they'll get into the weeds about the science, and the judges are not science people, they're business development people. So if you start with the Guy Kawasaki suggested deck, you'll be 2/3 of the way toward winning.
Well, I am 100% stealing that for TV pitches. So thank you. Okay, so let's talk a little bit about what happened after the CTSC Hackathon and how your work turned into what is now Thuvia Systems LLC.
I can get started, and then Emilia and Paul, you can jump in. So the first thing after you win the hackathon is that you need to have a Health Science Center PI or mentor in there, which in this case, I was the one. You have to write a grant of your idea. As Emilia said before, the idea that we pitch in 3 minutes is not the full story. So we have to write a small proposal for the 10K to the CTSC. So that's it. That's the critical aspect that many of the participants don't know, is that you have to write a proposal and have to have a PI from the health science campus. And once that is done, we were awarded for 1 year the 10K to work on this project. And along the way, we made a lot of progress. I will have Emilia and Paul and CJ talk about that.
Yeah, so initially you had asked about what our idea was, and I was kind of taken aback because it made me realize how much the idea has changed since that very first weekend. And so initially our idea really was about, can we use an inhaler that is essentially synced or communicating with a cell phone to identify triggers that people might not know they have. And so, if someone has to use their rescue inhaler, that would ping to their cell phone, and that location would be able to identify, where are you at, and is there something nearby that could have caused that exasperation. But our idea has since changed quite a bit, and that really came through customer discovery. And so today, we've really honed in on this idea of behavior, and that's because asthma is a chronic disease, and with many chronic diseases, it takes a toll on your life. You have to take the medicine every single day. It's a pain, it's costly. And so we really started to focus in on what that type of impact has on a person's life, and are there ways to nudge people to better habits. And so one thing that we identified through our customer discovery was that people have flare-ups with their asthma because they're not taking their medication. And so it's understandable why they're not taking their medication. It's hard, you have to do it twice a day. And again, all those other things like actually getting to the pharmacy to pick up your prescription, the cost of the prescription, all of those things contribute. And so are there things that we can do as kind of these behind the scenes app creators to help people remember to take their medication, remember to take it on time, and help them in a way that's going to make their daily life better. And so that's really where we've gone since Hackathon. And again, that all goes back to the customer discovery.
I'm just going to add on to that just a little bit, even though I'm pretty much going to recite what she said. But the funds that we got from that really gave us time, in my opinion, time to better figure out what are we looking at, what is the problem, to ideate, and then like Amelia said, ultimately to somewhat pivot our idea. And to the point of the customer discovery, we ended up doing the ICOR program at UNM, which is through UNM Rainforest Innovation. We got a great mentor and got to interview people that have asthma, physicians, people that have been in the industry, to just get the full picture of what's going on. Why are people with asthma not taking their medication? What are they currently trying to do? As well as we actually got to bring on an undergraduate engineer. That was my favorite part, was bringing on Dom, who's now our engineer. We got to give an undergraduate an opportunity to really get his hands on something real and then really progress our project. So it's great to give him opportunity as well as just from what we were able to come out of it.
Yes, Paul, you wanted to add on?
So then, the other interesting part of the journey since winning is figuring out how to communicate with each other. So everybody has a really different background. And it turns out that, you need a team that's capable of, where everyone on the team is capable of reaching across that chasm of background and understanding, sort of simplifying whatever it is that they're good at and making a case for that to the rest of the team. So I don't know a lot about asthma or pharmacology or engineering for that matter, but what I do know is like the timeline and the milestones for making a company operate. And this is pretty standard across business accelerators. So we know that we have like a 2-year timeline to operate as an LLC. And after that, if we're looking for serious capital, we're going to have to convert to a C Corp. And then there's the question of how do you reward the people who have participated in this endeavor without any salary, right? And so there's a mechanism for doing that called slicing pie, where people's fractional contributions on a weekly or monthly basis are recorded, and equity is assigned to that when we do a conversion to a C Corp. So, parts of the business development are standard. And of course, the other thing that CJ and Amelia have emphasized, which is also part of startup methodology these days, is customer discovery. So there's a tendency for scientists and engineers to stay in their laboratories, and perfect something that they don't know whether people want or not. And so that's how some projects fail. People bring a project to market without talking to people. And during the customer discovery process for this, we found some spectacular examples of that. My favorite is that there's an inhaler that it was designed to stop you from inhaling too quickly. And so they used a simple mechanical design. So if you inhale faster than a certain rate, it whistles. Well, it turns out children perceive that as a reward rather than a punishment. So they would deliberately whistle. And you're laughing. And someone else we talked to said, look, I'm a mom. I know in the first 5 seconds that you said this, that my kid would want to make it whistle. So that's an example of engineers that went all the way and brought a product to market without ever talking to anybody on the street. And so that's what the real value of the program that CJ and Amelia went through. It keeps us grounded in what actual people want, what physicians want, what patients want, and we avoid the worst of the stupid mistakes that staying inside the laboratory will create.
I love that. That's a really quality anecdote for why discovery, like research and discovery with real people who are actually going to use this, is so critical. So is that the path that you are all on right now in terms of, do you have a path forward? Are you planning to convert to a C Corp? What's the status of your LLC right now?
We're going to run through the end of 2022 and convert to a C Corp at the end. Either that or die, right? So, what happens is using slicing pie, your fractional contribution at the end of 2 years doesn't move the needle all that much. So at some point, at the end of 2 years, you say, okay, we're going to allocate equity according to everybody's contributions, and we're going to seek outside funding. The problem with an LLC is most angel and VC firms will not invest in an LLC. They want you to have a C Corp structure.
Gotcha. That makes sense. So before we dive into talking about this year's hackathon, which is coming up and people can register for right now, I believe registration is open. Before we circle back to finish with that, is there anything else that any one of you would like to add about your experience with the CTSC Hackathon or everything that has happened for you since?
I think one of the things that's been the biggest takeaway for me is helping me navigate where I want to go in life. So right now I'm in a master's program. So I'm getting a Master of Public Policy. Actually just added on a Master of Business Administration, both at UNM. And I think the beauty when I look back on CTSC is that I didn't know where I wanted to go. I was in a program called PrEP, and that stands for Post-Baccalaureate Research and Education Program. And that was also through UNM. And so I was pursuing sciences. I did biochem at UNM and then thought I wanted to go on to do a PhD. But I really wasn't sure of what that was going to play out to be. And so I dove into CTSC with the help and nudging of Pavan. And I think it really opened up a world that I didn't even know existed. And so since I was really young, I've always kind of been interested in inventing something. Like my mom always tells me that when I was little, I would come up to her and say, give me an idea, like I want to invent something. And so going to the CTSC was just kind of eye-opening and really made me realize that science, although I am still fully interested in it, a PhD might not be the route that I wanted to go, and that I could be involved with science without getting a PhD in science. And so thus, I'm now navigating the world of public policy and business because I've realized how public policy and business relate back to our healthcare system, the way patents are made, the way businesses operate. And so I think it just expanded my horizons of what actually exists and what career pathways are out there.
I will just add that for me, the biggest takeaway from Hackathon was working with a diverse team. I mean, when you're working in a lab, and I've had a lab for more than 12 years now, it's just my idea and my students' idea, and we are just focused on the expertise that we have. But within a weekend, we were able to get a team with very diverse backgrounds. And I think that makes a big difference. Paul was mentioning this before. When you talk to people from a very different background, you have to go to a level where the other member of the team can understand that. And that was something, a challenge for me. And maybe even now it's a challenge because you want your team member to understand what you're trying to say, right? And they would have to do the same thing. But I think when diverse teams work together, young people work together, it's a very dynamic and energetic team that we have as of now.
I just want to add one note, asking for help. I think it's kind of what Pavan's getting at as well, as this diverse team, especially if you're going to try to get into the startup world. You're not going to know everything. You're going to need partners. You're going to need evangelists, coworkers. And I think the tendency could be to try and box out the world and not let people know what you're doing and what you're inventing. But you're going to need a team. You're going to need a community behind you. And then the final thing that Amelia has really taught me is just saying yes. The caveat is making sure you still sleep, you still take time for yourself. But we did I-Core, we did Hackathon, all of these other things without people asking us, and just saying yes to opportunities that then open doors to other realms, to the job that I have now, to meeting other people. So just asking for help and then taking advantage of the resources that UNM is giving to us.
Yes, Paul?
So I'll just throw in that, and I'm sure that CJ and Amelia would support this. A startup is a lot more work and it's a lot harder than you first think, right? You might not have gone to the CTSC Health Science Hackathon if you knew what it was going to turn into. So the advice to other people attending is to pick a problem that matters. So you're going to have a problem. You're going to say this is a pain point. And do you want to make are you willing to make the sacrifices necessary to move forward on this problem? And if the problem is not significant, not particularly significant, it's not worth your time, right? So in my other life, I'm heading a company that does genetic testing on horses, and that's been actually pretty easy to get started on because the pain point is really, really high. There's a lot of people crying out for help. And it was clear that if you provided them with a solution, you had a company, right? So that's what I think people should think about going into the hackathon. When you hear those 1-minute pitches, what would happen if these people were successful, completely successful in what they're proposing? And if it doesn't really change the world, it's not worth your time.
I was just going to mention one thing, and that's that sometimes the market will say that what you're passionate about doesn't matter. And so don't take no for an answer, because if it's something you're really passionate about, and if it's a problem that you think is worth solving, I bet you there's lots of other people in the world who think so too. And sometimes these investors are only interested in the bottom line. And I don't think that should discourage you from following your passions and making a real impact in the world, because if you don't, then no one's going to solve these problems. So we need everyone really kind of pushing together and making sure we make an impact on the things that we're passionate about.
The dates of the hackathon are March 25th through the 27th, 2022. Registration is now live, and we will have the link both on the video here for folks and down below in our content summary. And the event is free and space is limited. So folks are asked to register by March 1st. So that's all the nuts and bolts of it. Amelia, take us home.
If I had any advice to give for someone contemplating whether or not they should go or not, I say jump in with both feet, because you never know what opportunity is awaiting you. And if you don't jump in, you will never find out.
Perfect. Couldn't have asked for a better closing line. Thank you all so much for joining us today. It's been a really fun conversation, and I'm so glad everyone got a chance to be here and share your stories with us. And we will again promote the hackathon with all of the relevant information below. And I really am excited to see what comes out of it next.